you have a bad back, you should never come up like that.
Okay.
She kind of did this, right? So she kind of half came up. So you want to first just roll onto your side like this, and then push off your elbow and your hand and swing your legs down at the same time. And use the momentum of your legs and then pushing your upper body upright. And you just do that. Okay. And it's super easy. Welcome everybody, thanks for tuning in. Dr. Kulla here with Synergy Wellness in New York City. Today we have a really interesting case and I really wanted to show this. Pilar had back surgery.
Yes.
And she's going to tell you a little bit about what she went through, but she had a lot of back problems, shooting pain down the legs.
Yes.
Years ago, and
I couldn't really walk.
She couldn't even walk. She did not go see a chiropractor back then, correct?
Yes, correct.
So she didn't really know about it. She's from Italy, and in Italy, chiropractic is not that popular. It may be now, but so after surgery, she had a, we'll get into it, she had a laminectomy. So a laminectomy, if you zoom in over here, you'll see laminectomy is when they remove the back of the vertebra. There's a left and a right lamina here. And when they remove that, it makes your back unstable. There's muscles that attach to the bones, to the vertebra. So she had a laminectomy on the left side. And how long was the surgery successful for?
The surgery was immediately successful in terms of pain. You know, for basically immediately took off the pain from. But then I had a very bad physical therapy, which actually made the case worse. So I ended up walking in a very odd way, and I ended up in a hospital in Italy, and they were thinking that I had some neurological problems from this because of the position that I was holding my back.
Okay.
So it was successful on one side, but not really, you know, for a long time.
And most back surgeries, 3 out of 5 back surgeries end up failing in 5 years or later.
Okay.
So if you follow up with people 5 years or later that have had back surgery, chances are that it's going to fail. And if it's not 5, at 10 years, that gets even higher, those statistics. So I'm not surprised by that. But she was referred in by another patient of ours. And when she first came into me, she could barely even walk in here.
Yes, I was crying.
Yeah, you were in tears. Yeah, you were in a lot of pain. Yes. And I think we had you up on your feet and ready to go in 2 visits, 3 visits.
Absolutely.
A total change. Now we did a specific technique. Now you never want to, a lot of people that get surgery, back surgery, are afraid to go see a chiropractor, and I get it, rightfully so. You do not want to be put on your side and cracked and pushed and pulled and tugged, and you got to be really careful about what you're doing. And there's only one technique, or the gold standard technique, that is the best for post-surgical back problems or failed back surgery. Again, there's only one gold standard technique, and that's Cox Flexion Distraction. We have a Cox table next door, but since the camera's set up in here, we're going to show you on our Hill Cox table. I know Dr. Cox himself would not like that, but we're going to show you for our purposes right here on this table what we do. And we did some cold laser therapy on her as well.
Yes.
She took a rental laser home for a few days, and that really helped calm the inflammation down.
Yes.
So we're just going to do a follow-up checkup today. So go ahead and lay on your stomach.
It was magical.
Great. I'm glad you're feeling better.
Yes.
Okay. And slide down so your chin is at the bottom of the paper there. Now, she doesn't do all that well with traction, so we put her in auto flexion to start with, just to loosen things up. So this table has a feature where it can automatically put her in flexion distraction. It's not the technically the Cox technique because it's being done automatically, but I'm going to come in here and I'm going to do it manually by hand in just a minute. And slide down a little bit more for me. Good. And as you can see there, it's going into flexion and distraction. We're just going to leave her here for a few minutes with some heat. And then we're going to manually do some Cox Flexion Distraction technique for her. Okay, now that we've done a little bit of auto flexion distraction, now we're going to get in there manually with the hands and do some Cox Flexion Distraction technique. This is such a gentle technique, and oftentimes patients see about a minimum of 50% improvement in symptoms in 4 weeks. In her situation, I mean, she was really severe. You should have seen her when she first came in. I wish we shot a video of that. But night and day difference, 2 to 3 visits later. If you've had back surgery and you're still having pain, no matter whether it's a laminectomy, a fusion, a discectomy, any type of back surgery, pretty much can be addressed with this technique, Cox Flexion Distraction technique. So as you can see here, it's a very gentle motion. Any pain here while I'm doing this?
No.
Any leg pain?
No.
So we had to take her through a couple of protocols before we could get her legs strapped in. So there's certain protocols you want to test people on first before you just go and strap them in and start doing this. Also, because she's had a laminectomy surgery and it failed, you want to be very careful putting her on her side. We have not put her on her side. I think we did it once.
Yes.
And it was a very gentle adjustment. This is not the case to be put on her side and adjusted the traditional chiropractic way. That's why we're doing this technique. That's why she needs to see a specific chiropractor that specializes in failed back surgeries like we do here at Synergy Wellness. So take a deep breath in and blow out. Good. And are you back at work yet?
Yes.
Good.
Yes, I've been able to work for several hours without any consequence.
Good. Can I give you your restaurant a little plug?
Yeah.
So if you're ever in New York City and you want to get healthy Italian food, you got to check her restaurant out. It's called Mille Nonne, right?
Correct, yes.
Mille Nonne. It's in the Essex Market in Manhattan off of Delancey and Essex Street,
Correct.
Right?
Yes.
Wonderful, healthy Italian. They even have vegan Italian dishes. That's kind of hard to find in New York City. Italian and healthy don't really go hand in hand. So make sure you check out her restaurant. She'll be there cooking because we got her back on her feet and she can cook now.
Absolutely.
Yeah. She hasn't brought me any lasagna yet, but
I will.
I'm just kidding.
It's a promise.
We're gonna stop by the restaurant soon. Any tightness or stiffness on either side?
A little bit here.
Okay. So we're just going to do some trigger points to loosen up some of the myofascial tension that she has in here. And when we do that and then do the flexion distraction, that really opens things up even more. Take a deep breath in. Good, and blow out. And again, when we first saw her, she wasn't even able to lay down on the table for more than, you couldn't even lay down on the table at all, actually.
Yeah, for very little.
Yeah, yeah.
Couple of minutes maybe.
So we had to adjust her on her side using Cox Flexion Distraction technique. So you can do this technique with a person on their side if they're unable to lay on their stomach, if they're just in so much pain. And deep breath in. Good, and blow out. In this situation, she's pretty tight, so I'm just going to go ahead in here and laser some of those muscle spasms. That'll really help melt things away and also reduce some inflammation for her. Laser treatment's only going to be a couple of minutes, and then we'll go ahead and continue the flexion distraction. Okay, so now we've done some cold laser therapy along the paraspinal muscles, the quadratus lumborum muscle, and now we're going right over that sciatic nerve and the piriformis muscle because she's a little bit sore on both sides there. And this is a 50-watt laser, so all it takes is about 60 seconds in each spot. We just did the right side, which is her worst side. Another minute there. So now that you're feeling much better, we'll get you started with some exercises this weekend, okay?
Yes.
Some real gentle ones, some light ones, nothing that's going to aggravate the back, okay?
Yes.
As we spoke about before, for you, that's one of the most important things when you've had failed back surgery, not only to get you out of pain, but to rehab that back properly so you're more stable, so you don't have reoccurring back pain or keep throwing your back out, okay?
Yes.
As much as we like seeing you in here, we like to see you standing upright and feeling good. So another minute here.
Yeah, I think that is the most important things, like to do to have a complete view of the problem that someone has.
So right now we've just gotten rid of the pain, taken the pressure off the nerves, calmed some of those muscle spasms down, and the next step would be to rehab the back and to strengthen the core. Especially if you're going to cook all that delicious, healthy Italian food.
Yes. I was surprised I was able to stand, for hours these days. I took care of sitting down once in a while, but not to sit for too long. I know I don't have to sit for too long, but just to give a pose to my back, walk around, and make sure I didn't move too fast.
Okay. Yeah, that's great news. All right. Now we're going to do our last round of flexion distraction. Okay, there are no pain into your legs, right?
No.
Another very gentle adjusting technique called Thompson Technique. All right, and on your back. Okay, there you go. slide my hand underneath. Okay,
Yes.
take a deep breath in, half a sit up here. Good, and blow all the way out. Okay, great. Now we're going to do the activator adjustment here on your neck. Turn your face to the left. Hands up in the air. Awesome. All right. Roll over to your side. Show everybody the right way to get up. So, yeah, almost.
Almost.
Okay, stand up. I'll show you. So if you have a bad back, you should never come up like that.
Okay.
She kind of did this, right? So she kind of half came up. So you want to first just roll onto your side like this, and then push off your elbow in your hand and swing your legs down at the same time. And use the momentum of your legs and then pushing your upper body upright. And you just do that.
Okay.
And it's super easy. That's the way to get up from your bed, from your couch, or even from the floor if you can. It's a little bit harder from the floor. Thanks for tubing in.